Is this the girl you told me about?
Yes, yes, we did.
Does she have a name?
Yes, we've named her Flipper.
Okay.
And you'll know why.
Just look straight down there, yeah.
Yes.
Wow.
There's no doubt about it. Right now, Flipper is in a bad way. She's just missing all that webbing, and really that foot of hers just looks so fragile now.
How's her general condition?
She's in good body condition.
Flipper was found by a member of the public who came across the stricken bird while out fishing.
When we saw Flipper for the first time and looked at her foot, we've never seen nothing like it before, so we couldn't really tell what's really happened to her.
And you can see the problem straight away. She's missing really that whole section there.
Yes.
And the fact it's not there worries me, but to be honest, what worries me the most is that this black colour really says that we've got dead tissue there.
A black discoloration to any part of the body essentially means the blood supply is gone and that tissue is dead.
This toe is not in bad shape,
No.
but you can just see where that webbing ends there.
Yes.
It's just hanging on for its life.
Chris has been called to help a pelican in distress on the Gold Coast.
These ones here, and even this one up here, isn't looking great.
I'm looking at that dead tissue and thinking, how am I going to treat it? But before I work out that, I have to understand what's actually caused it.
The way it looks, I would say either she's been bitten by something and she's got an infection after that,
Yes.
whether that's a shark, that's a possibility, or whether she's stood on something and got a little electric shock, because that does look like an electrical burn.
Yeah, it does, yes.
There was no fishing line on her, was there?
No, there's no fishing line, but you can see the old scars. Yeah.
All sorts of different possibilities as to what could have caused this injury are swirling around my head when all of a sudden my finger runs across a little groove on the leg.
I mean, that is quite deep, and that goes right around. See, that's interesting, because if she's had fishing line around there, that acts like a tourniquet, as you know, and so it starts to affect the blood supply to the foot below it.
Yes.
I actually think the blood supply has been so badly affected to the lower part of the foot, and especially the webbing and the end of the toes, that they're no longer getting blood.
Oh, yes.
And when tissue no longer gets blood, it starts to die off.
Yes.
It's like pieces of this jigsaw puzzle are falling into place before my very eyes. This fishing line wrapped around the leg essentially acted like a dam on a river. It blocked off almost all the flow. So further downstream in the toes or the webbing simply missed out. It went dry and therefore the tissue has died off.
So that's important, because what it tells us, and I think this is good news, is that we don't have a nasty infection raging that's trying to work its way up the leg. We've kind of identified the reason why this has happened.
Yes.
And now we also know that the blood supply should be returning back to that foot.
Yes. Yes.
The key now is to check whether that fishing line being wrapped around the leg for so long has caused a permanent problem. By simply pricking the webbing with a needle, we'll know straight away if that blood supply is present.
Oh, yeah, good.
Wow.
That's a good sign,
Okay.
isn't it?
Yeah, it is. So we've got blood supply there,
Yes.
and that's in the webbing. So that says to me that webbing's probably going to survive.
Now I know this foot is viable, it's important to make sure we don't have any further infection or any further damage to this tissue. There's not much left, so we have to make sure we preserve what is there.
Before we can fix this foot, the next thing I want to do is just see how she's supporting her weight. Because that's going to tell me how painful this foot is.
Yes.
On the Gold Coast, Chris is assessing the severity of Flipper the pelican's injuries.
She's taking, I would say, about 80% of her weight on her left leg, and that's going to cause problems in that leg too.
Yeah, will.
Flipper lost most of the webbing and toes on her right foot after fishing line cut off blood supply further up the leg.
First, let's clean this foot up, and then, while we're doing that, I'll try to work out a way to actually make this foot a lot more comfortable and a lot more functional.
You'll do it.
Thank you. I hope so.
Chris now needs to carefully clean up the infected area.
I don't really want to be too vigorous in there, because we've already got very raw tissue that if I expose it, it increases the risk of it getting a secondary infection.
Oh, okay. Well, Chris has been gentle, isn't he, huh? Yeah.
Okay, that's looking a lot better now. So
Yes.
that antiseptic will stop the bacteria from invading into those open wounds.
Yes.
That's a start. What's really going to help is some antibiotics.
The antibiotics will treat any infection or disease caused by bacteria from the injured foot.
We'll just do a little sting in this.
All right, so between the antibiotic and the antiseptic, I'm confident now that bacteria invading into this wound isn't going to be such a big deal.
Yes, okay.
All right?
That's good to hear.
Yes.
But I still think the biggest issue we've got is this pressure problem. She's just not comfortable enough or confident enough to put anything like what she needs to in terms of weight on this bad foot.
Yeah.
What really worries me about Flipper right now is the fact that she's a big bird. She weighs 6 kilograms, and all that weight going through one foot. Any bird is susceptible to a foot problem called bumblefoot. It's caused by too much pressure going through the feet and infections being the result of it.
I think I might need to go for a drive.
Okay. Wow, you're already on top of it.
I wouldn't say that, but I've got an idea about what I could use.
Okay. I'm not sure what Chris is up to, but he's on top of things already. He thinks so quick, he's just amazing. We know that Chris can fix Flipper.
I made a bit of a habit of coming up with interesting solutions for the twinnies, and today might be no different. So, it looks like I bought a yoga mat, but it's not.
Chris has come up with a creative solution for injured pelican Flipper.
You've actually given me the idea for this. We're going to give Flipper, or Flip, her own flip-flop. Because what we need here, it's cushioning, sure, but also we need protection for these toes that are still there.
Yes.
And we need a way to make her more comfortable so that she will actually start to put weight on this foot.
I'm thinking, what's the most basic form of footwear that offers some sort of comfort or even support? And suddenly, it hits me. It's thongs or flip-flops.
So, what I want to do is lay this out. Then I want her foot,
The good one or the bad one?
the bad one.
Okay.
I want her foot right there. Make sure she's nice and comfortable. Okay. So now, go right around it.
First of all, Chris needs to make a protective base for Flipper's injured foot.
So that is a good starting point.
Then, with the help of a reverse template of the pelican's good foot, he can start to put together his master plan.
We love Chris's idea of the flip-flop and for Flipper's foot, and we think it is going to work.
Pretty sure I haven't done this much arts and crafts since kindergarten. Right, so that's Flip's new foot.
Yes.
You can see where her existing foot is going to go in. And then, once those little toes are in there, we need to now secure them across the top.
Okay.
And the way we're going to do that is with this.
Good old Velcro.
Good old Velcro.
As Flipper waits patiently, Chris is attaching the Velcro that will help keep the shoe in place, along with some cushioning.
Okay,
Yes.
I think I'm ready for our patient.
Okay.
Like a podiatrist.
At the Twinnies Rescue Centre, Chris is ready to try out his carefully crafted shoe on Flipper the crippled pelican.
Little sweetheart.
This is really make or break for Flipper. This has to work, otherwise she could be facing a lifetime of problems.
Let's hope it fits, huh?
Yeah, it looks like it's perfect.
So, okay, so just like the straps on a pair of sandals,
Yes.
we'll start to put these across. So we're happy that it's sitting in there nicely.
Yes.
Nothing's rubbing, everything's been cushioned. Okay, it's a pretty good fit.
Yes.
I've got to say, I'm actually pretty happy with that. It is a lightweight fix for a heavy bird problem.
So
It's just going to take some getting used to for her. So once she feels like this is how it's meant to be, and becomes her new normal,
Yes.
then she'll start taking the weight off this left leg
Yes.
and shifting it onto the right.
Yes.
And we can start doing that by lifting up the left leg.
Yeah.
You see now, all that weight is through her right leg.
Yeah.
Really, a little bit of physio like that from the 20s, and in the next few days, we should really start to see Flipper starting to walk more normally and spread that weight more evenly. And that would be a perfect result. Let's put her on the ground. Let's have a look. I'll move this away.
Perfect.
What do you reckon? What do you think?
Oh my God. See? See?
Good pair of
Oh.
shoes. Yeah.
You're happy, miss?
A little flap of approval from the Flipper.
No. Look, she's walking perfectly.
She just wants to show off the new shoes to the neighbours.
That she's got it even
On there. Perfect fit.
And she's standing a bit more square, isn't she?
Yeah. Oh, what a sweetheart.
to bed. Well,
Amazing.
Done another good job.
this challenge, again, what Chris has done, he's an amazing vet, and
that's why we always keep our challenges for Chris.
All right, we'll leave her to rest.
Yes.
There you go, darling. Look at you.
I'll be honest, when I got the call from the 20s about Flipper, I had serious concerns that maybe I wouldn't be able to help. But thankfully, there's been just enough webbing there for me to make some sort of difference. As I've learned in the past, these girls have incredible powers when it comes to rehabilitating these birds. So in the future, I can't rule out the fact that one day, Flipper might be able to kick off those shoes and go back to the wild.
But thank you again.
No worries at all.
Thank you again.
It's always a surprise, but always a pleasant one.
Yes, and going to be plenty more.
Oh, that's all right.
We hope.
So do I.
You're a good boy.
Worried owner Sally has rushed in with her adored Pomeranian Chihuahua cross, Zach.
Where are you?
Found some grapes that I had in the fridge. I thought I'd have them, and I started to eat them, and Zach's looking at me, and I thought, okay, these should be healthy, you know. And I gave it to him, and I was really surprised that he ate it, and I was happy about it. I thought, great. He's still looking at me, and I gave him a few more, about 3 or 4. Then I looked on the Google to see, you know, if it's okay, and then highly toxic, they can die from them. You're a good little boy. I thought, oh my gosh, you know, I hugged him, said how sorry I was, little Zachy, I'm really, really sorry I did this to you. I'm thinking this is it, you know. I'm killing my own beautiful little dog that I love so much.
All right, Mr. Zach, why did you eat grapes?
Emergency specialist Mara is on duty and straight away begins a head-to-tail check of the little 4-year-old.
That was a very silly thing to do. I hope they were sweet and crunchy and tasty. Otherwise, no real reason to eat them, right?
Grapes are something that we've learned can be toxic in dogs.
No, it's a little hard, my friend, to listen to you with my stethoscope when we're cuddling like this. Can we not be bestest friends? Can we just be good friends for a moment? Thank you.
Some dogs can actually develop a toxicity that negatively affects the kidneys, and other dogs could eat a grape every day for the rest of their life and never have a problem.
Okay, let's see how your heart sounds.
And there's no way to know which dog is going to be the lucky dog and which dog won't be so lucky.
But your heart sounds pretty good. Beautiful painting. All right, my friend, you look pretty stable. I think we just need to get the grapes out of you. It's not going to be your favorite part of the day, I'm sorry.
Mara's hoping an injection of apomorphine will cause Zach to vomit the toxic grapes.
Okay. See, that didn't take you very long.
Now it's a waiting game.
All right, my friend. Now we give you time. What do you think?
A watched dog never vomits. Just get to stand here and wait.
Can you vomit? Can you vomit right in there? Yeah, just go and bring it up.
At SASH in Western Sydney, emergency specialist Mara is hoping an apomorphine injection will start to work quickly and Zach will vomit his deadly snack of toxic grapes.
Please. vomit. Just do it. We just want to get Mr. Zach's stomach empty because if the grapes are in there, the sooner we can get them out, the better he's going to be.
Owner Sally is devastated after giving what she thought was a healthy treat to her precious boy.
And who would have known that grapes are so highly toxic to them? Check before you give them anything to eat, you know, even if you think it's super healthy, but not for them.
Hi, what do you think? What do you think? I know, you just want to shake it off. Huh?
So far, Zach hasn't vomited with that first dose of apomorphine, which is not what I would want to see happening, but it's not uncommon. So we will try a second dose and see if that is enough to kickstart things in the right direction.
Oh boy, mister.
Okay. Oh, so brave. Yes. Okay. Will you please vomit? Pretty please? With grapes on top?
He's showing not the least sign of being nauseous, which makes me kind of want to bang my head against the wall a little bit. So it's time to get creative and see if we can do anything else that might make him nauseous. All right, we need a stool.
Time is now critical, with Mara desperate to try anything to make Zach vomit.
So, things that make me nauseous? Spinning in circles. What the hell's going on, huh, Lincoln? Don't worry, you're not the only one dizzy. Okay, that's enough for me. Woo! Take him.
Mara's definitely feeling nauseous, but as for Zach...
Oh, don't tell me I went through that. You're not gonna vomit, darling.
The grapes are staying put.
I'll just lip smack, that's it.
We've started the licking and the swallowing.
A bit of licking is the only progress so far.
I know, Zach, you can do it. It's okay, just let it go. Please. I am not quite defeated, but my optimism is going down. I know it's awful, and if you end up vomiting on me, it'll be worth it.
Mara's refusing to give up on her stubborn little patient.
Come on. Please don't have an iron stomach.
Please.
At Sash in Western Sydney, Mara has met her match. Pint-sized Zach still won't vomit the toxic dose of grapes.
Give in, my friend. I promise it's okay.
Mara's hoping it will be third time lucky, so Zach can avoid potential catastrophic damage to his kidneys from the toxic fruit.
That's right, you just shake it off.
I have not had many patients resist vomiting after having a third dose of apomorphine. Come on.
Nothing seems to be working, so it's time to switch to plan B.
We're gonna try the creamy tuna-scented treat and see if that makes our friend decide to vomit. Again, this attempt, anything at all that might make you vomit, I mean, if you're feeling at least a little nauseous and you smell something fishy, let's try that and see if that triggers things for him.
Hi. Do you want some smelly foods? What if I put a little tiny bit in your mouth?
With the grapes staying put,
You're just not vomiting for us.
Mara has one last trick.
If we can't get the stomach to empty as the first part of decontamination, the second part is giving activated charcoal, which is going to bind to the toxin that is still in his stomach and hopefully prevent it from being absorbed into his system. So fingers crossed that the charcoal at least will help decrease the risk for him.
Mr. Friend, we're gonna try and keep you clean.
I don't know if we'll succeed.
Oh my gosh, it's dripping everywhere.
I'm sorry.
Giving charcoal to a dog, it tends not to be a smooth and simple process.
You can do it. Swallow, swallow.
Is that nice?
Zach is a dog that's going to need us to really help him. Oh, so brave. Oh, so brave. Swallow. Oh, good boy.
The charcoal will bind to any deadly toxins in his stomach and hopefully prevent fatal kidney damage.
Is that nice?
He says no. No, that's not nice.
Good. Nice job.
Oh, so good.
Nice job. Wow.
Look at you. You're a rock star. The hope is that he is going to be one of those lucky dogs who doesn't develop toxicity regardless of what we do. And that hopefully the charcoal that we've given him just gives us that little bit of extra safety.
Can we take this off of you?
Pop. Hi. I think that's about all we're going to get.
Done.
For owner Sally, it's been a nerve-wracking wait.
You have the bravest little boy. He
He's been
was
a
so
brave
good.
boy. He's a brave little boy. He's little, but he's so brave.
Good.
Good boy, Zach.
We'll have him go home with you and just keep an eye on him.
Yeah.
If he starts to seem really sad and lethargic, if you're seeing that he's not eating, if there's any change in how much water he's drinking or how often or how much he's urinating,
it's abnormal, so
those would all be indications that he should get rechecked, and you're welcome to bring him back in here to us. If he does great, then he's the luckiest little boy ever.
So I'm feeling really, really relieved at the moment. And I can come back tomorrow if I have to. I know they're here, so I feel really good.
No more grapes.
Okay. Definitely no more grapes.
Yes.
We've learned the hard way.
No more grapes.
For Zaki.
Yes.
Yeah, thank you.
You're welcome.
Say thank you.
You say goodbye. Oh, you're the best boy.
Yeah.
Yeah. A brief goodbye. He's like, well, I like you, but that was more than enough. So gosh, I really hope that Zach is going to be one of the lucky ones. You know, he's got a great family, and hopefully that if any problem develops, they can catch it right away and bring him back to us. But crossing fingers, he'll go home and just wonder if it was all a bad dream.
Bird lovers Neil and Bloss are waiting for Chris with their badly injured 3-week-old cockatiel, Sydney.
What's happened this time?
You remembered us.
Of course I remember. Go on through. So who's this?
Sydney. His mother and father and brothers and sisters all tried to keep him warm in a little nest box, and hence the splayed legs.
Heard of close families, but that's a little bit ridiculous. When the whole family's come in and slept on top of Sydney, what that does is it forces Sydney's legs back behind him, squashes them down. I'm worried they're actually broken, or he's got some serious nerve damage there. At this age, they're incredibly fragile, and he could very easily have serious problems that just can't be fixed. What I want to do is just first of all feel for his hips, make sure they're actually in joint.
3-week-old cockatiel Sydney is in a bad way after his mum and dad and siblings all slept on him and crushed his legs.
So what we need to do is actually make sure that there aren't any fractures there. Femur feels okay, and these legs feel all right. The great news is Sydney doesn't have any fractures or dislocations there, but what has happened is those legs have been hyperextended back and locked into position, and now they're stuck there. If he's actually had nerve damage to the point where the nerves can no longer do that, then it's going to be really hard for him to actually live a normal life. Thought about it? There we go. You see that?
So what do you do, stick your tape into the perch?
No.
I was joking.
I'm not.
Oh.
Good chest line.
It's actually exactly what we do.
Really?
Okay.
Yeah.
Really?
Yeah. It seems a bit drastic, but often the drastic works. He looks like a bit of a ski jumper at the moment, but so you just give him very light support there.
Yes.
See how he pushes himself forward? He lunges forward like that. That's building up those muscles. Pressure there. Where did I learn about this? Made it up. So it becomes like gymnastics for him.
And the winner is Sydney.
But to make a full recovery, Sydney will also need an intensive physio program.
Bit of parrot Pilates. Push back on the knee, bring the ankle forward.
I don't think he's in pain while you're doing that.
No, he's all right. He'd be feeling the burn. Yeah, he'd be feeling the stretch. So push back on the knee and bring the ankle forward. So it's a lot of work for a little guy, but it's a lot of work that'll have big rewards if you can actually stick with it. Not all birds in this situation actually do make a recovery. It's about 50-50. I've got absolutely no doubt that Neil and Bloss will carry out these instructions to the letter. My biggest concern is whether little Sydney's body's up to it.
I love all my birds. I will give him Pilates. My animals come first before me, always.
G'day, good to see you.
Hey, Bloss.
How are you?
Good. Now, where is he?
Wrong cage, right behind you. Pick the bird.
Oh, man. Look at that.
I know.
This is Sid, isn't it?
Yeah.
That's it.
This is how Sydney looked only 3 weeks ago.
I'd be happy if we got Sydney to just be able to stand up. But he's perching on my finger there, and he's holding on tight.
You didn't think you'd get that good?
No.
To everyone's surprise, the bizarre bird therapy has worked.
You had to be fair dinkum. I mean, he's had more attention than the South Sydney Rugby League side, for God's sake.
I knew it was just time, patience and love would fix it. And it did.
That's it. We take the pencil global. Want some of the action? Huh? About the Sydney Brown pencil. Get the copyright done today. You and me. Make millions.
Howie came to us blind in one eye, and I think that's what attracted him to me, because he wasn't perfect, but he had such a smile on his face that I just fell in love. Our old dog Harry died 10 years ago, and we weren't going to get another dog, and then Richard and I went on the internet and found another dog independently, and it was the same dog, so that's how Howie became part of our family.
Hello, you guys.
Oh, Dr. Gay!
Look at you. I fell in love with Howie as soon as I first met him, with his little one eye. I think actually at that point I felt like he was wearing a patch, and it just melted my heart. I thought, this dog is so special. What's been going on? What's happening?
It's a bit of a cough. I've got a video of it that I took, and I just wanted you to have a look at it because, yeah, it's worrying me, and it's a hack.
Give us a look. Oh my goodness, that's less than ideal. Oh dear. It's a bad cough, isn't it? You watch yourself, look at you, coughing away there. What I can see from Jen's video is that Howie has this hacking cough. It's not looking good. It looks like it's making him uncomfortable. It looks like he's in distress as he actually coughs, and it looks like he's battling for air at times. Is it almost like in a fit of cough? Like does he sort of cough for 3 minutes sort of thing, and then it stops for a little while, and then it's in a sort of a fit of a cough, right? Yeah. And when was the first time that you noticed it start to get worse?
About a week ago, I suppose.
Okay.
Yeah.
If you don't treat a cough and you don't treat a cough as serious as Howie's, you can develop things like pneumonia very quickly.
We don't want him suffering. We don't want him in any distress. We just want him to be the happy little dog that he is and that we love.
Let's have a look at you, little groover. Let's see what we can do. Let's have a listen to that chest shook. Can I have a listen? Ready? Very crackly down there. When I listen to Howie's chest, I can hear that his lung sounds are increased. There's crackles, there's wheezes. There's a whole bunch of sounds there that really shouldn't be there. It's really important that we try and control this cough as much as we possibly can. And the second part is that it does affect his quality of life. You know, it means that he can't get out and play as much as he normally would. It means that he has to worry about breathing. If you don't treat a cough and you don't treat a cough as serious as Howie's, the chances of him living are actually pretty slim. I haven't quite thought of an absolute solution just yet, but I have some ideas on this.
I'm sure you do.
But you're gonna have to leave it with me, because it's some things rolling around at the back of my head that I think, is this a possibility? Maybe. I don't want to leave this too long, because it's pretty critical that we actually get a solution pretty fast. Hang 5 and I'll get back to you on it.
Okay. Yep.
Anything Kate can come up with, be great. You know, any suggestions really.
As long as he's comfortable and happy.
Yeah.
In Bondi, Kate has been researching a solution to help Howie with his chronic cough. And today she's delivering a special package to owner Jen.
Hello, how are you?
I'm well. How are you?
Well, I've got something for you both.
Okay, come through. I have no idea what Kate's got in store for us, but I'm sure it's something great.
I've got something that actually might help our little Howie here with that cough.
Oh,
might help him get a little bit more sleep. Well, let's have a look what's in here.
Oh, let me see.
Yep, I know. Okay. So this is a little spacer.
Spacer.
And this is a little Pomeranian-sized
my gosh.
mask. That just actually fits onto the end of this, right?
Wow.
Okay. And then what we've got is this little inhaler. It's a human inhaler.
Human stuff, Howie.
Human stuff, just like little kids get with their asthma. Okay, and we pop that just on the end, like so. And then his little face goes into here. Right, you do 1 puff twice a day.
Right.
And then let him have a couple of breaths.
Okay. We can handle that.
Mm-hmm.
Kate hopes that her solution will open up Howie's lungs and give the old Pomeranian a new lease on life.
Ready?
Ready?
Here we go.
Yep. There we go, Groover. Come on, Groover.
Wait a minute. Okay. And a puff.
And a puff.
1,
couple of breaths.
2, 3, 4, 5.
There we go.
It's over.
See? When Howie inhales the medication, essentially it acts as a little bit of an anti-inflammatory. It helps open up all of those really small little airways so that Howie can actually get more oxygen into his lungs. It also stops the mucus build-up in the lungs, so it means that Howie's not going to feel this constant need to cough. We're going to monitor him for the next couple of weeks.
Yes. Hopefully it'll do the trick, though.
Hopefully we'll do the trick. What do you think?
Yes, she should. Thank you, Dr. Kate.
It's looking particularly cute today.
He is. He's an old dog, but if we can improve that, his, senior years, well, that's what we're going to do, and we're going to make it as comfortable as possible for him. Wow, Howie, look. There's a whole big gang of dogs coming.
It's been a week since Howie has been on Kate's innovative inhaler regime to help him with his chronic cough.
Hi.
Hi.
Devoted owners Jan and Richard are thrilled with the results.
Since Howie's had the device, it's really improved him dramatically. He doesn't cough as much, well, hardly ever now in the mornings. We give it to him twice a day, and it's good.
Wow. What do you think of that, little boy? There's a big difference in Howie's behaviour. Like, he's not as sluggish and he seems happier and more content with life.
Yeah, for sure.
You're much better. It's so
He's
good.
a lot better.
He is.
Aren't you, little bloke? Yes.
Dr. Kate's been wonderful. Hey, How?
He's an old dog, and anything that we can do that will, help him along the way, we do. And this has helped him a great deal. So it's a win-win as far as I'm concerned.
Good boy.
All right, come on.
In Atlanta, Georgia, Juliet and her son Jordan have arrived to see Arvid with an unusual pet.
Hi, how are you? This is Bedrock. This is Bedrock. I got Bedrock when he was about the size of my palm, and he was 2 months old, and now he's 7.
Bedrock is an African spurred tortoise.
Bedrock is a really fun tortoise. He has a lot of energy. He's very spontaneous, and he likes to go running around, and he's an escape artist, likes to explore.
All right, so the moment of truth is here. I know you've kind of given me a little brief background over the phone, but this is my first time seeing Bedrock, right?
She's actually got this really hurt arm. If I'll pull her out.
Okay.
Let's turn her around.
She's very attractive.
Yeah, she's got a beautiful show.
So tell me more about the injury. What happened?
She unfortunately got it caught in some mosquito mesh outside of my gazebo, and it got wound up really, really tight. It was about 16 hours before I caught it, and she actually did really fine for a long time. And this was over a year ago the injury happened, and just in the last 2 or 3 months, she's been declining.
And when you say declining, she's like not walking on it anymore?
She'll walk on it for food, but she really doesn't want to put the weight on it. It seems to bother her, and her foot just seems to have disappeared.
And since then, it's just kind of been going downhill.
Well, she did fine for a very long time, and she had a little bit of a limp, and it was maybe a little discomfort, but not something you would see every day. It would be like on an occasion.
Yeah, you can definitely tell that this tissue here is looking devitalized there, and see any way to salvage it. I'll tell you what I'm gonna do. We get some x-rays, we'll get some blood work on her, and try to see if this is something we can kind of rehabilitate and maybe bring back. If not, then we may be looking at potential amputation.
Right.
So that she could have a good quality of life, because definitely this leg doesn't look good at all. Amputating the leg is obviously the last resort, you know, and so.
Or even maybe removing a part of it, if it needs the whole thing taken off.
Typically with these guys, because if you leave a stump and they're able, it can continue to get irritated. So usually if we're going to amputate pretty high up.
Right.
And then we'll have to maybe put a prosthesis on the bottom of the shell here to kind of, elevate it.
Yes.
But if we have to amputate, I will definitely let you know. And of course, the anesthesia in these guys are very tricky, but that's one thing that we take very seriously.
Yes.
Is very monitoring them very closely.
Right.
Yeah.
I just want the best for her. She's great.
She's gonna do fine.
I've had her through thick and thin.
So I am really worried about Bedrock's leg, because it doesn't look like there's any blood supply going to that leg. It looks like it's been cut off and the leg is actually rotting. You can see the skin sloughing, and she's definitely in pain. So I'm really worried that we may not be able to save this leg. I'm hoping we can, but realistically, it's not looking good.
Oh, you're beautiful.
Oh, baby. Oh, she's so
She's
strong.
real strong.
Holy moly. Okay.
You're doing great.
Ready? 1, 2, 3, poke.
In Atlanta, Georgia, Arvid and his team are facing challenging amputation surgery on 7-year-old tortoise Bedrock.
It's gonna make you feel better, I promise. Got some really, really good pain control.
The thing with these guys, it's tough to do much without anesthesia. And if you get your hand caught between the leg and the shell and they draw that leg back, they can really break your finger and do some damage. These guys are super strong. So we're gonna give them a little sedative to relax them so we can get the x-rays, get the total picture, get the ball rolling with getting Bedrock back to good health.
Yeah, let's put her all the way side, lateral.
Here's the problem. Definitely there's some lucency changes in the bone. Almost looks like it's like a moth-eaten appearance. Yes, you can see that with cancer, but in this case, I just think it's infection that's gotten into the bone. And you can see the digits look like they're kind of eaten away. So if you look here compared to the normal leg, which is here, you can definitely see the difference. You can see all the digits coming up here, but then on this leg, they all look like they're cut off, and the digits, all that looks like it's been eaten away, and there's some infection and inflammation in that bone. She's not gonna get that back. So unfortunately, it looks like the next step is to amputate. I know it sounds kind of brutal, but in the end, she's gonna be happier, healthier, pain-free. Hello, Juliet. It's Dr. Edward.
Hi, how are you?
Hey, so we took the radiographs of Bedrock, and unfortunately, in her leg, and especially in her bones, there definitely looks like there's some inflammation and infection that's kind of eating away at the bone. You can definitely see some bone loss in some areas where it looks like there's some moth-eaten appearances. So, unfortunately, it looks like we're gonna have to amputate.
Right. Are you gonna take the whole leg?
Yes, we're gonna take the whole leg.
I know she's safe in your hands.
Yes, we're gonna take good care of her.
All right, thank you so much. Thanks for letting me know.
You're very welcome.
So you just go up and like this.
So now we're about to place the endotracheal tube so that we can get her induced for anesthesia. So the thing about these guys is that they have a really short trachea. So the tracheal bifurcation is very high as opposed to a dog or a cat. So when you're tubing these guys, you gotta be very careful not to go too far down, or you can only oxygenate one side of the lungs, and that's not good. So I created a little plastic gadget, if you will, to prevent that. We can just keep the eyes where we can move them. She's doing really well. And we have her Doppler hooked up so we can hear her heart rates, which is very important because it's not like I can put my stethoscope on there, so. I'm concerned, but I'm optimistic. Bedrock seems to be in good health, very strong girl. However, reptiles with anesthesia is very dicey. It makes you nervous. I'm not gonna lie, I'm nervous, but we gotta do what we gotta do. Okay, I'm cutting.
Okay.
So my goal is to get Bedrock home. I know how much she's loved by her family, so that's what I'm gonna do. Trying to do this surgery around the shell is just tough. So I'm trying to navigate with this shell in the way.
Any recoil?
She flinched. I don't know if I hit a nerve or... So because she's still flinching, when I hit certain spots, that tells me she's still feeling it. So we're gonna have to give her a little more sedation to try to get her down to where she's not feeling this at all. So just still dissecting away here, trying to get down to the joint so that I can disarticulate this leg at the joint. It's just a very tight pocket, so it just makes it harder. So the problem is she's still twitching. So we're trying to get her to where she's supposed to be anesthetically.
Arvid now has to administer even more sedative to ensure Bedrock is not aware of the intrusive surgery.
This right here is why I don't do reptiles often. Okay, go ahead and lift up the leg. Yeah. I'm having a tough time finding joint space. So what I've decided to do is to saw the bone off cranially as I can, and I think that'll do the trick.
Okay, leg is off.
Okay, we can go ahead and start to close. So over the next few days, it's going to be very critical as to how Bedrock does from this surgery. We waited for her to go down with anesthesia. Now we got to wait for her to wake up. And in tortoises, that can take a long time. So our work is not done. So with tortoises, they're slow to go fully down on anesthesia, but then waking up takes them just as long, if it's not longer. So we're in for a long wait. So now we're about to do the prosthesis so that we can give some elevation to that area now that she doesn't have a limb, to help with her mobility, prevent damage to the shell, and help prevent injury and pain. So the arm will come here, so I'm thinking like right there. Because when I seen the wheels, they've all been like right there.
Okay.
Set time of 15 to 25 minutes. So I'll put a prosthesis on her, something that I made up with like a tennis ball. So I just hope she's able to keep it on for, a good amount of time.
Oh, good morning. Good morning, sunshine.
So she's starting to recoil her head now. She has retracted it back into the shell, which means she's starting to come to.
So she's finally giving us some reflexes here. So you can see she's pulling in those feet right when we pull them out. She's giving us some resistance here.
Bedrock's owner, Juliet, is keen to be reunited with her special girl.
I'm excited to reunite Bedrock with her owner because I'm pretty sure her owner has been sitting on pins and needles all day, and she's gonna be extremely happy to see Bedrock, and not just see her, but very happy that she made it through the anesthesia. I know that was a big concern of mom's.
Hi, my girl.
Maybe she hear your voice, that might wake her up.
Hi, girl. Oh, my baby.
She's got a little prosthesis to see how it kind of elevates that shell.
Yes, do you think it'll have issue against some concrete?
No, because this slides.
It slides, great.
This slides.
Absolutely.
Yep.
This looks fantastic. Very ingenuitive. All right, thank you so much.
You're very welcome. Absolutely.
I'm very grateful. I know
Good.
she is as well.
Yes.
I'm definitely very relieved that Bedrock is okay, and I'm just really grateful the surgery went well.
All right, you have a good one. All right?
All right, great.
All right.